So you've probably heard the myth that autistic people don't do drugs, but the reality is far more complex than that. In fact, some of the symptoms of autism are like basically directly linked to drug addiction. So today I'm going to explain that relationship between autism and addiction. So for a while, we just kind of assumed that autistic people didn't do drugs and then didn't do the research on them. And then finally one day we started to do the research and realized like, yeah, there is actually an increased vulnerability to addiction. And this is a big problem because about 1% of the world and about 2% of the US have a diagnosis of autism spectrum disorder. And we also know that autistic people are more likely to have another diagnosis. So these are commonly things like anxiety, depression, ADHD is another big one. But the more diagnoses you have, the more likely you are to abuse substances too. So when we started to do the research, we found that autistic people are more likely to use drugs. And not only that, but they also have like increased mortality from drugs. Compared to non-autistic people who use drugs, autistic people were more likely to die early from problems including drug abuse. Autistic people are also more likely to self-medicate, and they're more likely to be tricked into drug use too. Which, y'all, who is doing that other than the CIA? So which drugs are autistic people more likely to use? Well, the things that we see most often are things like alcohol and weed, which makes sense because those are just the easiest to access. And that is one of the major problems with autism and addiction is that you need that kind of social aspect of drug use. According to one study, it is like socially tricky to get your hands on drugs that are not legal. Which makes sense. You have to go out there and find them. You have to have a network of people who are able to give you access to those drugs. And people with autism are less likely to actually have that network. Now, if you read the AI on this, they also say that autistic people are more likely to use hallucinogens. There's no evidence of that. Now, to be fair, hallucinogens could reduce the symptoms of autism, and so people could use them because they're actually just wanting to reduce some of those social problems, but we do not have the science backing that right now. Now, when we look at things like alcohol and weed, the reason why people say that they're using them is for things like self-medication. So a lot of autistic people are saying that they're using alcohol to kind of help them with those social situations and also help them through like periods of stress, of which they have a lot because they're autistic. And for weed, the idea is the same here. So weed is doing things like decreasing anxiety in autistic people, and so it is helping them to kind of decrease those potentially problematic symptoms that they're experiencing. Now, we do see that there are also these risk factors involved in this relationship. So if you have ADHD, so autism with an ADHD diagnosis, you are at the highest risk of drug abuse. And this shouldn't be shocking either. We know that people with ADHD are more likely to abuse drugs, especially things that are self-medicating those symptoms too. So if you have symptoms of ADHD and you also have symptoms of autism, maybe you're doing drugs to just reduce the symptoms of both of those at the same time. Also, we see that autistic people on the higher end of the social spectrum, as well as the higher end of intelligence, they are more likely to use drugs. And we see that there might be a genetic component too. So we see that autism spectrum disorder and things like alcohol abuse are very strongly heritable, suggesting that there is this strong genetic component that is basically increasing the likelihood of both of them. So it could be that somebody with autism is also more at risk for alcohol use disorder just because of the genetics. And they suggest that this might be true for things like opioids like H2. But we don't have good evidence saying that autistic people are more likely to use opioids. Now, loneliness and social isolation also appear to be big risk factors as to whether somebody with autism spectrum disorder is more likely to use drugs. So they're more likely to turn to drugs to also reduce some of that loneliness. And once they start using drugs, it becomes even more of a problem. So now they have an additional stressor, the fact that they're using drugs, they're trying to get a hold of them. And that might cause them to have even worse symptoms of autism. Drugs are also going to make them have more problems with things like decision making and coping skills. And that's going to make their everyday problems even worse. Then there are all sorts of problems associated with treatment. So a lot of people in the drug addiction realm do not necessarily feel confident treating somebody with autism spectrum disorder, and vice versa. People in the autism spectrum disorder treatment realm do not feel comfortable treating people with addiction. And to be fair, they're both incredibly complicated disorders. Just think about the differences between addiction with different drugs. Alcohol addiction looks very different than meth addiction, which looks very different from opioid addiction. That isn't even counting all the new drugs that are out there that people can be addicted to, that addiction treatment does not necessarily know how to deal with. Now you're adding a complicated psychiatric disorder on top of that. People are going to feel ill-equipped to deal with it. So we know that autistic people are less likely to go into for treatment, but maybe it's just because the treatment is not necessarily targeted towards them. So there are underlying vulnerabilities that autistic people are more likely to deal with, which makes them more likely to actually start using drugs. And then treatment is not even targeted towards them, so they don't have a good ability to actually stop using the drugs. And then we don't even have the research out there to try to help people who are trying to navigate this addiction as well. And that's because it's really hard to study this. So for example, we now have one disorder that was different from what we previously had. So our idea of what autism even is has drastically changed in the last 10 years. We've been kind of revamping the diagnosis, which means that a lot of our previous research is no longer fitting with how we see autism nowadays. And then if you look at the autism spectrum, so again, autism spectrum disorder, it is a spectrum which has two extremes. People on either side of those extremes, they're going to have a very different profile. So they're going to be autistic people with very few social impairments, with maybe more language impairments. They are potentially more vulnerable to drug use. But then you have people on the opposite side of the spectrum with potentially more social deficits. They are not as likely to be entered into the kind of drug world. And so they actually have a protective effect against addiction. How do we even study this? So yes, autistic people do still do drugs. And in fact, they might be at more of a risk for addiction. And the more that the public and even science keeps believing in this myth, the worse the long-term consequences are for autistic people with addiction.